talk to us a little bit about that, because I have actually noticed students who are very, very good academically, and they're actually doing really well in quizzes, in class. Teachers are like, wow, this guy's a great, student. They're definitely going to ace it. But when it comes to the NBME, they're not doing well. And then you talk to them, and then you're realizing that they have like this crazy anxiety. They're having the strategies that they're employing in again, I'm not an educator, but it just doesn't sound optimal. So talk to me about this test taking strategy. Are you born with it, or is this something you can develop? Or if you don't have it, you're never becoming a doctor?
It's a skill like anything else, whether you want to play a sport, right? This is a sport of sorts. It's a skill that, and I know because I was in school, St. James, a lot of universities, everyone does their very best. But we don't really focus on working on test-taking skills. So, read the material, read the PowerPoints, learn the content, yes. But then you have a USMLE exam, which is very different than anything else you've ever done before. So that's why I realized that if you don't adjust and expose students, like St. James and everybody else watching, to the question format, Doc, my friend, Doc, whoever's watching, reading the material, you have to apply to the questions. Like being in the hospital, right? You're in class and you go see patients. In class, I give you PowerPoint presentation, findings, right? There's no connections. So when you read a question, you have to be able to pull out the findings and connect. So to answer your question, it needs a lot of time and practice. And that's why one of the main reasons that we do at USMLE trainings is, hey, you got to come to us with knowledge. You're in medical school, right? So, okay, you know the basics. The problem is, can you put it together in a question, reading, understanding, and connecting? And I see a lot of students, American students, international, Caribbean, the biggest common denominator is test taking. They'll study for a year, man. They'll memorize first aid. They fail. Why? Test taking. It's a common denominator all across the board.
Okay. And as far as